Hello, my name is Ayanna Boyce. I'm a licensed certified genetic counselor at the Ridley-Tree Cancer Center. I'd like to thank the Breast Cancer Resource Center for inviting me to join this webinar series. Today we'll be discussing genetic testing. Is it for me, and how genetic counseling can help you? So to start, we'll go through a cancer genetic counseling overview. I'll walk through a couple of case examples so that you get a sense of what genetic counseling looks like in practice, and then I'll just briefly touch upon direct-to-consumer genetic testing. That's genetic testing like 23andMe. So what is genetic counseling? Often when I meet new people, they ask me what I do. I share that I'm a genetic counselor, and they've never heard of genetic counselor. They've never heard of genetic counseling. So as a genetic counselor, I'm a healthcare professional with specialized training in medical genetics and counseling, and I provide genetic counseling, which really is a process to evaluate and understand an individual or family's risk of an inherited medical condition. And in this setting, we're talking about inherited cancer conditions. So what do I actually do as a genetic counselor? I help people understand their genetic risks based on their family history. Family histories really are the main tool that we use to help assess the likelihood of inherited cancer. I help people develop a personalized medical plan, and again, this is based on a family history and genetic testing results. And I enable people to make informed decisions about genetic testing. So we always want people to truly understand what genetic testing will mean for them and their family, and be fully informed about what different options are out there. I help explain genetic testing results and help people process the medical and emotional implications. And I can help connect people with resources. So for example, if we do learn that someone has a more rare hereditary cancer condition, we can refer them to different resources, such as support groups, to connect them with other families dealing with the same condition. So to give you a sense of what a genetic counseling session looks like, they typically last about an hour. And to begin with, we always discuss the reason for referral. So we might have someone who comes in because they asked their doctor for a referral, and it's helpful for us to understand what motivated them to ask for genetic counseling, and they can share a little bit about where they're coming from. Or we might have someone come in who was referred by their physician, and they don't really understand what genetic counseling is and why they're speaking with us, and so we can explain a little bit more about the reason for referral. We'll then take an individual's personal medical history and their family history. And those two tools in combination are the main things that we use to assess for the likelihood of an inherited cancer condition. And they can help tell us if someone meets criteria for genetic testing. We provide genetics education. We always want people to understand what the results will mean for them, and at least have a brief understanding of inheritance and the implications for family members. We explain any potential testing options. There's not only one genetic test out there, so we can walk through the different options and talk about what might be clinically indicated based on a personal and family history, and help facilitate the decision making based on how much an individual would like and what makes sense for them based on their personal and family history, and we can obtain that informed consent. If someone opts to pursue genetic testing, then we'll order genetic testing and we'll meet with them for a follow-up appointment. And at that time, we'll deliver their genetic testing results and we'll discuss the implications for both them and their family. And throughout this whole process, we're able to help provide emotional support. Of course, we're talking about challenging topics such as a higher risk for cancer. And so we're there throughout this process to be emotional support. And we also work as a part of a multidisciplinary team. We always want to make sure that people's physicians and healthcare providers understand the genetic component of the condition and make sure everyone's on the same page. So just a note on family histories. They're really the basis for our initial risk assessment. They're what we use to help tell us if someone meets criteria for genetic testing, if there's certain conditions of interest, certain genes of interest. So they're really important before we order genetic testing. But they're also important for once we get genetic testing results back. Both the family history and the genetic testing results are what we use to help provide specific management recommendations going forward. And the family history can be helpful for us even if no genetic testing is done. Sometimes it might not be indicated to order genetic testing based on a family history, or an individual might not be interested in pursuing genetic testing, and at that point we can offer suggestions based on a family history. So helpful both before and after genetic testing. And when we're taking a family history, we're looking at the cancers in the family and we're trying to put them into one of 3 different categories, where the vast majority of the time cancers are sporadic. Those are those cancers that happen by chance or maybe due to an accumulation of environmental factors. Sometimes cancers fall within this familial category, and that's when there might be multiple factors at play, maybe multiple low-risk genetic factors with a combination of shared environmental factors amongst family members causing a cluster of cancers in a family. Most rare is hereditary cancer. It's only about 10% of the time where cancers are hereditary, when there's one strong genetic factor being passed down through a family causing a higher chance for cancer. So when we're taking a family history, we're looking for certain features that might increase our suspicion of hereditary cancer. So one of the things we look out for is young cancers. Certain cancers under the age of 50 can increase our suspicion for hereditary cancer. For example, breast cancer in a woman's 20s, 30s, 40s, that can increase our suspicion. We look for multiple cancers. So if we see both breast and ovarian cancer in a woman, that can increase suspicion, or bilateral breast cancer. Rare or aggressive cancers, so something like breast cancer in women, prostate cancer in men, both unfortunately quite common. Something more rare would be something like ovarian cancer or male breast cancer. Family history, like I said, is very important. So if we're seeing a certain pattern, like multiple generations, a grandparent, a parent, a child, all with the same types of cancer, or maybe a clustering of multiple cancers on one side of the family, like 2 aunts and a cousin with the same cancer, that can increase suspicion. And then ancestry. There are certain ancestries where we see a higher proportion of hereditary cancer. For example, we see a higher proportion of hereditary breast and ovarian cancer in the Ashkenazi Jewish or Eastern European Jewish population. And so that's something that can help clue us into a higher likelihood of hereditary cancer. Just a note that's not on this slide, sometimes we can get an increased suspicion for hereditary cancer based on genetic testing that can be done on a tumor test. Oncologists might order genetic testing on a tumor to help with treatment decisions, something called somatic testing. And if we get back a result on a tumor test in a gene that's associated with a hereditary cancer condition, that might indicate that there could be a higher likelihood for hereditary cancer and might warrant a referral for genetic counseling. And why do we care to learn about hereditary cancer? Really, it's so that we can help be more targeted in what management options we can offer going forward. So in the general population, of course, we all have that chance of getting cancer, and there are things that we should all be doing to help with that, such as reducing exposure to certain risk factors like not smoking cigarettes, or starting cancer screening at a certain age, like starting breast screening at age 40 for women. If we know someone has familial cancer risk, then we can perhaps be a bit more targeted with the surveillance. Maybe if there's a cluster of breast cancers in a family, we're suggesting breast MRIs in addition to annual mammograms. But if we know if someone has hereditary cancer, again, we can take all of those things that I just mentioned, but also be even more specific in the surveillance guidelines and also be able to provide risk-reducing agents, risk-reducing surgery to help with that risk. So really taking all of those into account can be really helpful to learn about hereditary cancer so we can be more specific with the management going forward. All right, so let's walk through a genetic counseling appointment. I will say that the case that I'm about to present is quite striking and obvious for hereditary cancer. Not all cases that we see look like this, and so I wanted to show you an example where we're seeing a lot of different features, but sometimes we'll only be seeing 1 or 2 of these features, and that might still indicate a reason to consider genetic counseling. So I'll introduce you to Amanda. Amanda is a 48-year-old woman with a new diagnosis of breast cancer. She's just in the process of initially meeting with her different physicians to determine a treatment plan, and in meeting with her breast surgeon, she was referred for genetic counseling due to her young diagnosis and her family history of cancer. So at the beginning of the genetic counseling appointment, a family history was taken for Amanda. This is a pedigree. This is how we depict family histories in genetic counseling. So to orient you, we depict females as circles and males as squares. So we have Amanda there where the arrow is. Her siblings are next to her. Her children are below her. Her parents are in the line above her, grandparents above that. So what are we seeing when we're taking this family history? We're seeing relatively early diagnoses of cancers in the family, with Amanda being 48 and her mom being 40 at the time of her first breast cancer. We're seeing more than one cancer in one individual, thinking of Amanda's mom having breast cancer in both her left and her right breast. We're seeing multiple relatives on the same side of the family with cancer or related cancers. We can see breast, prostate, and ovarian cancer come together, so thinking about that with Amanda's mother, her uncle, and her grandmother on her mom's side. Unusual or rare cancer, so again thinking of Amanda's grandmother's ovarian cancer. And aggressive cancers, so something like prostate cancer, when we see it be more aggressive, if it's metastatic, if it's spread to other areas of the body, that can increase suspicion for hereditary cancer. So taking Amanda's personal and family history into account, she does meet the National Comprehensive Cancer Network guidelines of when we would offer genetic testing. And the first condition that comes to mind with the breast, prostate, and ovarian cancer in the family is hereditary breast and ovarian cancer. The most common known cause of hereditary breast and ovarian cancer is caused by a change or mutation in the BRCA1 and BRCA2 genes, or the BRCA genes. So a brief background on these genes. BRCA1 and BRCA2 are genes that we all have, men and women. We have 2 copies of each, one from mom and one from dad, and they normally work to help protect our body from getting cancer. It's just when someone's born with a change in a gene, that's what we call a mutation, causing the gene not to work correctly, we see an increased risk for certain cancers. So as a part of the appointment, we're discussing hereditary breast and ovarian cancer and mutations in BRCA1 and BRCA2, and we talk with Amanda about what risks we think about with a BRCA1 and BRCA2 mutation. So this graph depicts the risks that we see when someone has a BRCA1 or BRCA2 mutation, with the red bar lines indicating a BRCA1 or BRCA2 carrier's risks, and the blue bar lines referring to the general population cancer risks. And you can see the biggest risks that we're thinking about are for female breast cancer at up to a 70% chance over a woman's life, and ovarian cancer at up to a 44% chance over a woman's life. Now, part of what we can do in a genetic counseling appointment is be more specific as to what does this actually mean for the person in front of us. So if Amanda was found to carry a BRCA mutation, we would talk to her in more detail about what does this mean for her already having a history of breast cancer? What's her chance of getting a second breast cancer? For her being a 48-year-old woman, what's her chance of getting ovarian cancer in the next 10 years to the age of 58? And so that's something that we would talk about in more detail if Amanda was to come back positive for a BRCA mutation. I will mention, of course, you can see here there's prostate cancer, male breast cancer, pancreatic cancer for both sexes, and so learning about a BRCA mutation really is helpful for all family members. So as a part of the genetic counseling appointment, we always want to think about who in the family is the best person to consider genetic testing. So we always like to start genetic testing with the family member that looks most suspicious for hereditary cancer, a family member who's actually had cancer with the associated condition that we're thinking about. So in this case, someone who's had breast, ovarian, or prostate cancer. Since Amanda's just been diagnosed with young breast cancer, she's a good person to consider genetic testing. But it is not always the case that we're meeting with someone with cancer. We might get a referral for someone who's been referred because her mother had breast cancer in her 30s and she's wondering about her cancer risks. So when that happens, we always talk to people about talking to their family member about considering genetic testing. If her mom is able to consider genetic testing as she is the one with young breast cancer, she'd be a good person to first test, because if we can first understand why she got her breast cancer, then we know exactly where to look in other family members to see, did they inherit that gene mutation or did they not? So in this case, since Amanda actually has had breast cancer, she's a good person to consider genetic testing, and she is interested in proceeding with genetic testing. So we walk through the different genetic testing options with Amanda. So we've talked about BRCA1 and BRCA2, two genes associated with hereditary breast and ovarian cancer, but there are other tests out there. Typically we order something called a multigene panel, which is when we look at multiple genes at the same time. We're looking at maybe 20, 30, 40 genes associated with hereditary cancer. And that's a really good way to make sure we're not missing something. If we're casting a wider net to multiple genes, we're more likely to get answers as to why we're seeing a pattern of cancers in the family. And there are other genes out there associated with breast and ovarian cancer, so doing a bigger test allows us to include those genes. But when we do a larger test looking at multiple genes at the same time, it does open up some doors to uncertainties and unexpected findings. And so part of the genetic counseling appointment is to walk through the benefits, limitations of these larger tests, and then help facilitate the decision as to what test might make sense for the person that we're meeting with. And then we always want to discuss the possible outcomes of genetic testing. So there's three main genetic testing results where it could come back completely negative, normal, meaning that we do not find a mutation, and at that point we defer back to an individual's personal and family history to determine a management plan. They could come back positive. We find hereditary cancer, we find a mutation, and then we would talk in more detail about what that means for the individual and their family. The third type of result is something called a variant of unknown significance, which is essentially a question mark result. It means there's a change in a gene that we don't understand. It might be normal or it might be harmful. So if we get that type of result, we don't act on it, we just wait for more information. The genetic testing companies are constantly trying to gather more data to hopefully in the future be able to reclassify that result and tell us whether or not it's actually positive or negative. So at this point, Amanda has elected to pursue genetic testing. She opts to do a multigene panel looking at hereditary breast and ovarian cancer genes, a total of 23 genes. She provides a blood sample. We can do genetic testing on either blood or saliva. And about 2 to 3 weeks later, her genetic testing results come back. And we meet with Amanda to discuss these results. So Amanda does have a BRCA1 mutation, meaning that she has hereditary breast and ovarian cancer syndrome, providing an explanation as to why we're seeing the pattern of cancers in the family. So part of the follow-up appointment is to thoroughly go through the risks that we know associated with BRCA1 and what the management recommendations are for Amanda based on this result. So to give you an example of one of the things we'd be discussing is with BRCA1, we know there's a higher chance for a woman to develop an initial breast cancer, but there's also a higher chance for a woman to develop a second breast cancer. And so since Amanda's just recently been diagnosed, she might want to use this information to help inform her surgery decisions. She might opt to do a larger surgery, a full mastectomy and preventative surgery on the opposite side to greatly reduce the chance of another breast cancer. That's not the only option out there, and so again, part of the appointment is to walk through the different options, whether it be surgery, screening, and discuss all the cancer risks, again, ovarian cancer, pancreatic, and other cancers we see with BRCA1. And then of course, family. You know, we're testing an individual, but really we're testing a whole family. Amanda's results are important not only for her, but for her entire family. So now that we know that Amanda has a BRCA1 mutation, we know that each of her siblings are at a 50% chance of having the same result, and so genetic testing is available to them to find out if they have the same BRCA1 mutation. We know that Amanda would have inherited this from either her mother or her father. Of course, it looks more suspicious that it came from mom's side of the family, but sometimes we're surprised and it might have come from dad's side, and we're left without an explanation for why there's cancers on mom's side. So it's helpful for a parent to test to confirm which side of the family it came from. And that also helps us to know which more distant relatives might benefit from this information. If we know it came from mom, well, then we know that her uncles are at a 50% chance of having the same result, and that could help tell Amanda's cousins what their risks are. Thinking about Amanda's children, her daughter's 16, her son's 14, they're still young. We wouldn't offer them genetic testing at this point. We only do genetic testing in childhood if it impacts a child, if it changes their management in childhood. And since with a BRCA1 mutation, we don't see a change in management, we would wait until they're at least 18 years old and they're an adult and they can make that decision for themselves. And so one of the things that we can discuss in a follow-up appointment, though, is we can talk about how to have these discussions with children. Of course, Amanda's children are watching her go through a cancer diagnosis, doing surgeries, doing treatment, and talking about hereditary cancer is just one more thing on top of everything else. And so we can help navigate those conversations with children and other family members. So I just wanted to touch upon one other case example that illustrates a different side of genetic counseling. So here we have Cindy. Cindy's a 35-year-old woman who does not have cancer herself, but she has multiple women in her family with breast cancer diagnosed under 50, with her mom having breast cancer at 45 and her maternal aunt having breast cancer at 49. Both of those relatives have done genetic testing and their results were negative. No mutations have been found in the family. So Cindy's wondering what she should be doing for her screening and what her risk to develop breast cancer is, given no mutations have been found in the family. A case like this is fairly common. Unfortunately, we're often left without answers as to why cancers are in a family, and that's when we defer back to the family history to help inform how best to manage people. And so for Cindy, we can help by running her computer empiric breast cancer risk models. These models are used to help tell us what someone's chance of developing breast cancer is. And why we do that is if someone's chance is over 20%, that makes them eligible for increased breast screening. There's a couple different models out there, but one of these models was run for Cindy that takes into account her age at 35, her relative's age at their diagnosis, and then it tells us what her chance of developing breast cancer is. And since her risk is at 31.6%, it's over the 20% cutoff, making her eligible for doing annual breast MRIs in addition to her annual mammograms based on the recommendations by the American Cancer Society and the National Comprehensive Cancer Network guidelines. So again, this is the case where genetic testing wasn't indicated, but we can still help provide some management recommendations for Cindy based on the family history. All right, so I just wanted to briefly touch upon direct-to-consumer genetic testing. That's genetic testing that's marketed directly to consumers. So something like 23andMe. Often we'll have people come in and say, I've done 23andMe, do I really need to be here right now? And I do want to be clear that the genetic testing that I've been discussing today is really, it's clinical genetic testing for medical purposes. The direct-to-consumer genetic testing is for recreational purposes, and we wouldn't want anyone to be making medical decisions based on a recreational test. Sometimes those tests do touch upon hereditary cancer, but they might not be complete tests, and so there could be false negatives, false positives. And so if someone ever has questions or concerns about a direct-to-consumer genetic test, we recommend that they meet with a genetic specialist who has expertise in these direct-to-consumer genetic tests to hopefully get their questions answered. So just to wrap up, I'll leave you with a couple take-home messages. So genetic counseling really is the process of helping people understand and adapt to medical, psychological, and the familial implications of the genetic contributions of diseases. Again, in this case, we're talking about hereditary cancer, which is rare. It's only 10% of the time where cancers are hereditary. And why we care to learn about hereditary cancer is to be able to be proactive, to provide more targeted screening, prevention to an individual and for their family. And genetic counselors can be of help even when no gene mutation has been found in the family. We can still help make some more targeted management recommendations based on a family history. So I'd like to thank you for your attention today. If you have any questions about if you should consider genetic counseling, I would recommend that you speak with your healthcare professional. If you have any questions about how to be referred for genetic counseling, you can contact the Ridley-Tree Cancer Center Genetic Counseling Program at our email, genetics@ridleytreecc.org, or by calling our office. And if you need help finding a genetic counselor outside of the Santa Barbara area, I recommend you check out the National Society of Genetic Counselors webpage, nsgc.org. My name is Ayanna Boyce. I'm a licensed certified genetic counselor. Have a great pink week.